Thank you everybody for joining us today. Hi and welcome everybody, and thanks for being here on behalf of the Environmental Finance Center. Welcome to the first of two online trainings that we're doing on financial recovery for COVID-19 and customer assistance programs for small water systems in Washington State. Today's session is going to be a presentation on customer assistance, and tomorrow's session is going to be more of an open forum where you can ask questions that are pertinent to your water system's recovery from the pandemic's effort. Including customer assistance, but also could be anything regarding financial recovery or how you're dealing with COVID-19 conditions. My name is Shadi Eskaf, and Heather Himmelberger and myself will be presenting these two sessions today and tomorrow. During the session today, please make sure that you remain muted. I think we've muted everybody to start with, but we're going to keep everybody on mute. If you have any questions, please use the chat function to type in your question, and we will queue them for response at the very end. This session is being recorded and will be posted online on the Environmental Finance Center Network website. You'll be receiving a follow-up email with a link to all the materials, including this recording, as well as a copy of the slides and any other information that you might need. Registered attendees will receive a certificate of participation in the training over these 2 days. So once you complete both days, you'll receive that certificate. For water operators specifically, this 2-session training has been approved for 0.3 training credit hours. And in order to receive credits for these 2 sessions, you have to attend both sessions today and tomorrow, all 3 hours, and participate in the polling questions that we will be posting. You need to be registered and attend with your real name and have your unique email address. So if you are calling in from a phone number, you might want to try to log on the computer and have your name displayed for the webinar. Your certificate of attendance for everybody will be emailed to you within 30 days of the training dates, which will be tomorrow. And if you have any questions or need assistance, please contact smallsystems@syr.edu. For a little bit about the Environmental Finance Center Network and our program. Our program is providing training and technical assistance or direct assistance to small water systems in all the United States and territories to help water systems achieve their goals and stay in compliance with the Safe Drinking Water Act. We do all these services for free, no cost to the water systems. And that's in cooperative agreement with the United States Environmental Protection Agency. Here you can see various centers that make up the Environmental Finance Center network across the country. You can see that the centers and partner organizations are spread all over, and we coordinate quite a bit to address all the questions and needs of small water systems on this, in this program. And on that note, we'll introduce our speakers for today, starting with Heather Himmelberger, the Director of the Southwest Environmental Finance Center. Heather, would you please introduce yourself?
Yeah, hi. Welcome everybody, and thank you so much for being here, and thanks for letting me speak today. Again, as Shadi said, my name is Heather Himmelberger, and I'm the Director of the Southwest Environmental Finance Center, and we're located at the University of New Mexico. I'm an engineer by training, but I like managerial and financial a lot, and that's kind of where my career took off after about the first 8 or so years. I've headed down in that managerial financial world, and I really like working with water and wastewater utilities. So I've been doing it now for about 35 years and really have seen water and wastewater all over the country, and look forward to talking today about the financial topic, which again is one of my passions, is how do we pay for the service that we have to provide. So back to Shadi.
Thank you, Heather. And to continue my introduction, I'm Shadi Eskaf. I'm a Research Director and Senior Project Director at the Environmental Finance Center at the University of North Carolina. And I work with local and state governments on water rates, rate setting, affordability and equity, regionalization, capital planning, funding, benchmarking, financial sustainability, anything to do with financial management of water, wastewater systems. Been working at the EFC here since 2004, and we've seen all sorts of issues that come up from financial viability and sustainability. And then now with COVID, sudden changes to revenues and how customers are paying their bills and how do you handle all these changes. So we've been doing a lot of trainings and a lot of direct assistance recently focused on addressing these needs across the country. So we're happy to be doing this today here for Washington State. And we also have with us, well, before we get started, we do have one poll question just to kind of get you warmed up on polls. We'd like to know in the audience right now, what kind of organization are you representing? Are you here for a small water system serving fewer than 10,000 people, more than 10,000 people? Are you a state, federal agency? A technical assistance provider like Rural Water Association or RCAP or any of the organizations that help water systems, or something else? And this is just to get your fingers warmed up because we'll have a few more of these polls throughout the webinar. And we'll give you a few seconds. Looks like we're almost complete. Okay. Thank you, everybody. And let's share the results. So as you can see, the vast majority of the attendees are here from a water system or local government or that has a water system, which is great, evenly split between small and large. We have a good representation from state federal agencies, and we appreciate that. For water systems attendees, our focus for this webinar is going to be on small water systems. Those are less than 10,000. But the issues and the topics that we're talking about today about customer assistance really applies across the board. So whether you're small or large, these issues and these topics are across the board. The difference might be that with larger systems, you have more capabilities and more capacity to be able to do a little bit more sophisticated, a little bit more tailored or customized kind of customer assistance programs. So you might have some additional questions that we might not address during the presentation, but feel free to ask those questions either today or tomorrow. So thank you for responding to this poll. And for the two sessions, today and tomorrow, our session today is going to be focused on customer assistance and what to do about helping customers pay their bills and stay connected to the water system. And this is in response to the governor's proclamation and order prohibiting disconnection, disconnecting customers from non-payment and setting up customer assistance programs. So we'll be talking a lot about that. It's going to be a presentation type format today. Tomorrow's session is going to be more of an open forum. We don't have a lot of presentations for tomorrow. It's mostly going to be just open forum. You ask us your questions. We received a lot of questions already as you were registering for these two sessions. We appreciate your questions. We're saving most of those for tomorrow's session. So if you've already submitted a question and we don't answer it today, it might come up again tomorrow, but feel free at any point today to ask your question about customer assistance programs, even if you've already asked that while you were registering. We'll be happy to try to answer as many questions as we can today, but we'll have a lot of time tomorrow for questions, and not just about customer assistance, but anything to do with recovery from COVID on the financial side of things for water systems. We have with us today Mr. Derek Pell, sorry, it should say Derek Pell, I apologize for that typo. He's a Deputy Director for Operations of the Office of Drinking Water for Washington State Department of Health. Derek, would you please unmute yourself and introduce yourself and have a discussion with the small systems.
Unmute. Can you hear me now?
I can hear you now. Thank you.
All right. Well, hello, everybody. Thank you for letting me have a moment today. I just wanted to reflect on kind of the unique period that we're in right now. It's not often that we get to live through a 100-year pandemic event in our public health careers. And in January of this year, COVID-19 arrived in Washington State. It became very real, very fast, and we were the first state in the nation that have to respond to this. I do want to say hats off to our nurses and our doctors that responded. And then it was our epidemiologists that responded. And then our full public health system kicked in. The Washington State Department of Health stood up an incident command team to help contain and fight for resources in this experience. And then for a period of time, about 60% of our Office of Drinking Water staff were committed to the COVID response. We are in a process of setting up a whole new division to continue our COVID response work. So washing hands with soap and water, singing the ABC song, these are things that we took to heart early in the practice in response to COVID, and instantly drinking water utilities became first responders and essential service providers to help reduce the spread of the virus. And as an essential service, Governor Inslee prohibited the shutoff of water utilities and directed utilities to evaluate their customer assistance programs to keep the sanitation barrier in place for all consumers. A pandemic, it changes everything. Illness, isolation, quarantine, death, survival, and recovery. It changes our economy. It changes how we interact socially, and it changes how we do our work. It changes our behavioral health, and it changes what we think we know of ourselves. The provision of safe and reliable drinking water is essential, but it is not free. And in these times of enormous stress, we must look out for each other. We must recognize utilities and the ratepayer impacts and think about new ways of doing business. And that's why this workshop is so important. I want to take a moment to thank the Environmental Finance Center, Shadi, Heather, and our own Fern Schultz for organizing this workshop and sharing expertise. Thank you to all the utilities who've taken the time to attend, and thank you to everybody who helps ensure public health. Shadi, back to you. Have a great day.
Thank you very much, Mr. Pell. All right, so we'll get started today, and I think we're going to be starting off with providing a little bit of a framing of the issue. What are some of the competing and main objectives and priorities of water utility, and kind of the strange dichotomy that we're living in these days? And I think Mr. Pell kind of mentioned that a little bit. So we'll start off with that, and Heather will be presenting that session, that part of the session. And then following, we'll be talking about alternatives to shutoffs and then providing assistance to customers to keep them connected and to help them pay their bills and to help them maintain service during these difficult times, not just now while the proclamation and the state of emergency is in effect, but also after that. And we'll have quite a bit of discussion about formal customer assistance programs. Formal meaning, we'll be talking a lot about different types of customer assistance programs, but the formal here meaning that there are some programs that you can set up to help customers actually pay their bills. So we'll have a little bit more discussion for those type of programs beyond the others. And then we'll have time for questions at the very end. So at any point, again, use the chat box to submit your questions. Heather and I will keep an eye on those questions. We won't respond right away. We'll try to save them towards the end of the webinar. And whatever we don't respond to today, we'll bring back in for tomorrow's session. So Heather, let's start with you. I'm going to stop my share and ask you to share your screen.
Okay. All right, just a quick check, Shadi. Are you seeing just the one slide just to make sure the share is going properly?
Yes, it's working great.
Well, again, welcome everybody, and I'm so glad you're able to be here today to talk about this very important subject. And we're just going to spend a little bit of time framing the issue. Derek did a good job of starting us off in this fashion, but we want to just make sure that we all have a really good frame of reference to be talking about this issue. Then we're going to dig deeper into some of the things that you can do as customer assistance programs and other alternatives. So what is the number one goal of a water utility? Well, the number one goal is really protecting public health. Even more than just providing water is we really are about trying to protect the public health. And there's lots of reasons, and you may have seen this graph before from the Centers of Disease Control, where it talks about typhoid fever and the death rate from typhoid fever. So back in the 1900s, it was quite high. And then we found chlorination, which was really a disinfection process, a way to make sure that we were killing germs in our water supply and keeping it safe to be able to not just provide water to the public, but water that was safe. And then you can see the death rate drops dramatically so that it's almost to nothing by the time we hit 1950. And just one more graph to just show the leading cause of death. Back in the 1900s, you know, waterborne illness was about the third leading cause of death, and in 1997, it really doesn't even make the top list. And it's not that there aren't anybody who dies anymore from waterborne illness. We still have Legionella and a few other things that happen, but very, very low rates of death. And we always want to be working hard to make sure that that's as low as possible. So our number one goal is always to make sure that we're protecting the public health. So what are some other goals of utility beyond protecting public health? Well, protecting the environment, customer service, maintaining your assets in an acceptable condition so that they can do their jobs, providing that reliable supply. So beyond just protecting people, we want to make sure that the water is actually there, and most of your customers will not be happy if they turn on their taps and there isn't any water. We want to be able to manage risks, so meaning if we understand to make sure that we know what risk is and what assets will cause the most risk or what activities cause the most risk, so we can manage that over time. And then replacing assets as necessary. So assets wear out over time, they decay, so we need to be able to replace those assets. So these are some goals of utilities. So what does it take to achieve these goals, as well as protecting the public health that we said was the number one goal? So it takes money. No question about it. You have to have funds to be able to do all these different kinds of things. So you end up with two competing priorities. You want to protect public health, but you also want to ensure that the system has adequate funding to do what it needs to do. So what impacts your ability to protect public health? There's lots of things, but I've picked out a few that are kind of some key things that get involved in this. So operator training and certification. So do you have operators that know how to do their jobs? Do they understand what the regulations are? Have they had sufficient training so that they can meet those regulatory requirements, as well as all the other things they have to do? Do they know how to fix something that breaks? Do they know how to do all the day-to-day things that go into it? So operator certification and training is certainly important. Another one is just having enough personnel. So we talked with the operator training and certification, we're talking about the individual people. Are they certified and trained the way they should be? But another aspect is, do we have enough? So it's really hard to protect public health and provide reliable service if we don't have enough people at the utility to get that done. Another thing that gets involved is increasing regulation, and over time regulations are definitely going up, especially for groundwater utilities. A lot of the regulations that have happened in, say, the last decade have been ones that maybe affect groundwater utilities more than the regulations that came before. A lot of the regulations before were more surface water oriented. So now we have regulations that we're always looking for new contaminants and, you know, new things to worry about and concern ourselves with. So then increasing regulation can be a problem. Our man-made and natural contaminants entering source waters, whether that's surface or groundwater, there may be things such as pesticides that we add, or PFAS and PFOA, which are talked about now, and there's also some naturally occurring contaminants such as arsenic that can get in our water, and that can cause us trouble. Decaying infrastructure, which we mentioned before, that as the infrastructure is wearing out, that leaves more opportunity for contaminants to enter in, or for us not to be able to provide for the public health protection. And then we might not have the right technologies, the right treatment technologies in place to be able to meet the public health requirements that we have. So what impacts the ability to ensure the adequate funding? So the other side of the spectrum, like having enough money. So rising costs is certainly a big one, as the costs of even paying your operators can go up. So personnel costs can increase. The cost of buying gasoline to put in your vehicles can increase. The cost of buying supplies, pipe and wells, tanks, all that sort of stuff. So the cost going up can impact your ability. So if you're not raising enough revenue to cover these rising costs, that can be a big effect. The economic conditions in the community, and this could be either a localized problem or a national problem. So we're experiencing some of both right now with the pandemic. So the pandemic is affecting the entire country, but it's not affecting every community within the country the same way. So certain communities are being less impacted than other communities. So it kind of depends on what your customer base is made up of, you know, what type of economic engine your community has. If it's maybe more of a tourist economy, it may have been hit really, really hard in the pandemic, versus if it's more of an economy where people can work from home, it may be less impacted, but that can be a big issue. The number of low-income customers that you have can be a big concern. So if you have a lot of low-income customers who really have difficulty paying, that can be problematic versus, you know, having a few low-income customers. So you really need to understand your customer base and what you're asking of them in terms of rate payment. Lack of rate increases. So a rate increase doesn't just happen. Your governing body, whoever that might be, whether that's a city council, county commission, a homeowner type utility where there's an elected board from the community. So whatever type of governing body you have, that governing body has to pass rate increases. And if they're not willing to do that, that can be a real problem. So maybe you need a rate increase, but they don't want to charge the customers. And sometimes people run on platforms, you know, while they're trying to get elected where they don't want to have rate increases. So that can be a problem. Changes in water usage can be a problem. So if you have volume-based billing, sometimes at volume-based billing, you charge more for a customer that's commercial versus residential. So if the usage changes and we have more residential customers and we have commercial customers, or residential usage than commercial usage, we could actually have less revenue even for the same amount of water being provided. And we have seen this anecdotally in some communities across the country where the residential usage has increased and the commercial usage has decreased, but the overall usage in some cases is even higher than it was before, or maybe about the same as it was before. But it can change the financial picture for the utility, because that residential customer might be paying less than the commercial customer for that same water. So even though you're producing as much water, you're not getting the same revenue. So that can be problematic. And then you have competing costs of other goods. So water is not in a vacuum. When you charge a customer a water rate, they're not just paying for your water. They have all kinds of other expenses. They have food, energy, housing, clothing, you know, all kinds of other things that they have to pay. So when you charge a higher fee for water, it has to be taken into context with all the other things that a person has to pay for. And it might be, you might have difficulty paying, especially if those costs are going up. So without adequate funding, the ability to provide public health protection and reliable service is much more difficult. So we kind of have this idea that we can just provide good service forever, regardless of what the financial picture is. And that's not really true. And Derek talked about that some as well, that we do need to have funding to be able to provide the service to our customers. So we really do need to understand, you know, both sides of those, you know, competing priorities. So where does most funding for water utilities actually come from? It comes from your customers. By and large. So unless you have grants, and grants are getting much more difficult to come by these days, and generally they're fairly small. So unless you have grant funding, you are getting your money from your customers. So even if you have an outside loan, like from the State Revolving Fund or Rural Development or some other agency who's providing you funding, your customers are going to have to pay back that loan. So maybe they don't have to come up with, you know, the whole cost of a project up front, but they're going to have to pay it on the back end in terms of rates. So we do want to understand that most of the funding, you know, by and large for almost every water utility is going to come from the customers in some way, shape, or form. So during normal times, a portion of the customer base is going to have difficulty paying their bills. So whether or not we had COVID, there is going to be a portion of the customer base that can't pay their bill. Because, you know, of the reasons we talked about before, where maybe they have a job loss or they have other expenses that they have to pay for, and they're trying to balance, you know, housing and food and medical expenses against, you know, other things like water. So when customers can't or don't pay, we do have some small amount of customers, or at least we hope it's small, where they have the ability to pay, but for whatever reason they just don't. Either they forget or they don't want to, or whatever it might be. So there is that segment that doesn't pay, but by and large, it's customers who can't pay that are not going to pay you. And you usually go through a number of steps to try to collect the required payment. So it's not usually the situation where a customer hasn't paid their bill and right away you're running out and shutting them off. That is not the typical way of doing things. Typically, we want to have some process in place that's a stepwise process that you go through to try to get the customer to pay before you have to shut them off. So it can include things like maybe giving them a late notice, having a late fee so that they don't want to be late paying, setting up payment plans, anything that you do up front, maybe trying to get them into a customer assistance program if you have one, whatever you can do to try to recoup those funds prior to shutting somebody off. But sometimes all else fails and you really don't have a choice. You have to shut the water off. And sometimes people use property liens in addition to water shutoffs or instead of water shutoffs. And with property lien, you're typically not going to get paid until the property sells and then you get your money, or until you have to force a sale. But in a water shutoff, the idea is you're going to inconvenience the customer so much that they're going to want to pay their bill. So it's kind of the method of last resort to try to get the customer to pay. So now if we fast forward to our pandemic event, this is a major disruptive event across the entire country, and it was particularly impactful to Washington, especially at the beginning when the pandemic first started, at least started in the United States. So now that portion of people who are unable to pay may dramatically increase. And one utility that we were just talking to recently had a 600% increase in the number of customers who were unable to pay. So prior to the pandemic, they had, one number of customers that are typically unable to pay, and now 600% higher increase. So that's a huge dramatic increase for that particular utility. So if you're in that same sort of scenario where you have a lot higher number of people that are unable to pay, that can be a real big problem. So customers have many concerns that may make it, hard for them to pay, things like job losses or job hour reductions. Maybe they got a pay decrease. Maybe the business they were working for closed. Maybe they have an illness of themselves or family member and they're not able to go to work. Anything like that can really impact the ability of a customer to be able to pay. So, and again, these can be localized effects or they could be more systemic, meaning like the whole state or the whole country. So depending on what community you're in, these different effects can be greater or lesser depending on your community makeup. But on the other side of the coin, the pandemic actually increases the need for safe, reliable water. So while it's decreasing customer ability to pay, it's increasing the need for water. So we have more customers working from home. We have more customers at home in general as students are doing, school-age students are doing like remote school and that sort of thing. And there's fewer places you can go. You can't travel the way you did before. So there's a lot of people just at home in general. So they really need the water at home for general hygiene and hand washing purposes. And of course, the CDC has recommended a pretty thorough hand washing process that takes a while. So we have to have water in the home at this time. So to address these kinds of concerns, Washington, like many other states and localities, implemented a moratorium on water shutoffs. And that, lots of places, either statewide or just the cities, decided to implement these moratoriums. So it's not unusual that Washington is not alone. There's a lot of places that did this. And in this case, the objective of that public health protection was considered to really outweigh the objective of financial health, at least for a period of time. So for a period of time, the decision was made that we've got to protect public health at all costs, and then let's address the financial health at a later time. So we're kind of at that later time now. So now we're here to say, okay, when the moratorium is lifted, what's next? So we've kind of gone through this whole time period where we've prioritized the public health end of things, but now that may have left some of your water utilities in you know, a little bit of financial concern. Maybe you've had more customers than just those that were unable to pay who didn't pay. There's some evidence, as we talked to some utilities, that customers interpreted the no shutoff to mean they didn't have to pay. So there was a little bit of that going on as well. One utility is a fairly large utility in Kentucky, was faced with the first message of we're not going to shut anybody off to all of a sudden we don't have to pay, and lots of customers not paying their bill because they misunderstood what it actually meant. So you may have had all kinds of impacts financially, but now we have to move forward and say, okay, what's next on the agenda once the moratorium is lifted? So one option is to resume shutoffs once the moratorium is over, and the other is to consider other potential options to try to avoid those shutoffs, either really adding extra things to try to prevent a shutoff, or to take the approach that you don't want to do shutoffs later. So some potential options for you to consider is water restrictors. So a water restrictor is something that's practiced less in the United States than it is elsewhere, but there are several European countries that do this. The whole country of New Zealand does this, and then several states within Australia use this approach. So rather than allowing shutoffs, and in fact, New Zealand, they're banned at the federal level. You can't shut anybody's water off because they feel like that is too impactful to their public health. They had to come up with another way. So what they came up with was water restrictors. And the water restrictors just cut the flow to the house to just a very small amount of water. So you can still wash your hands, you can still get a drink of water, you can still cook, but to try to do much else, is going to be very inconvenient. It's going to take a long time to fill up a pot of water or a tea kettle or something like that. So you can do it, it's just really inconvenient. Because it's inconvenient, customers would still want to pay their bill to get their water back on, but they're not going to face a public health, serious crisis in the meantime while you're trying to get them on a payment plan or get them to pay their bill. So it kind of helps on both ends, where it's straddling that line of trying to provide public health protection and prevent, real financial hardship for the utility. So another option is a device that shuts off water after a certain flow passes through the device. So this is something that was tried in South Africa, where they wanted to allow customers to have a certain amount of flow. So maybe, 500 gallons or something. So they would say, okay, we're going to let the water flow at whatever rate it normally does, but after a certain amount of flow passes through, it will be shut off and you can't have any more water. So a customer would have to be pretty careful about making sure that they, didn't use all the water right at the beginning of the day, because then they wouldn't have any more. Again, it's very inconvenient, so customers would not hopefully want this to continue, and therefore they would be wanting to pay their bill, even though they do have some water. It's not enough water to really do all the things that they need to do. Another option is placing customers in a payment plan, even if it's a really, really long-term payment plan. And as long as payments are made, there's no shut-off and no restrictions on the water flow. And there are some countries in Europe that take this approach, where they try to say, okay, even if it's going to be 5 years for you to pay back that bill, as long as you're making that payment, which maybe is another $5 a month on top of your normal bill, or $2 a month, or something, might be a really low payment. But as long as you're making that payment, we're going to be in an agreement with you that we're not going to shut off service. So you will get your money, it will just take a little bit longer to do so. Another option is to really think about having conversations with your customers, either individually or as a group, to try to determine potential options, like what would work for you, what are the types of options we should consider. And I think Shadi will go into rate options and that sort of thing in a little bit, but there might be different types of rate structures that would be more beneficial to customers, like maybe the base bill, the base bill is so high that's really hurting your low-income customers, and maybe you want to consider a lower base bill with a higher volumetric charge or something like that to really help those customers. So thinking about having a conversation with your customers as a way to look at other options that you can do. want to bring up the issue of thinking about whose problem is it when customers can't pay. So if you have customers that are unable to pay your bill, is that their problem, i.e. the customer who can't pay, or is it our problem, meaning the whole utility, the whole community? You know, how do you frame that sort of question of whose problem is it? And just a subtle change in how you see the problem can really help. So when you think of it as our problem, there's really more incentive for the whole community to get involved and look for a solution. So we really want to think about what are the responses that the whole community can have to try to help look for the solution. And I want to give you one example, which is Cincinnati. And they changed their mindset a few years back from it's their problem to it's our problem. And they decided that if you're going to do that, if it's our problem and not just their problem, then we need to look at it as a community, as a whole community, and see what can we do. And also they wanted the utility to be part of that solution. So they didn't want to look at it as utilities doing everything right, the customers are wrong, so we should just not worry about it. They wanted to see it as we are not succeeding in our mission. If there are customers who can't pay and who have to be shut off, we're not succeeding, so how can we address that? So one example, or one thing that they did, was they wanted to start listening sessions throughout their community. And I don't remember precisely how many neighborhoods there are in Cincinnati, but I think it was somewhere around 28 neighborhoods. So they have utility personnel, hopefully who live in those neighborhoods, but if not, you know, somebody could cover a different neighborhood. And once a month, those employees would get time off of work to go to a selected place. It might be a library, it might be a community center, a grocery store, something like that, where customers knew they were going to be there and they could have a conversation about anything they wanted. So they could ask specific questions about their bill, or how the water utility works, or you know, what kind of treatment you provide. It could be anything. And it was a chance to really listen to the customers and get to know them better, and really let the customers know that the utility was out there. Now, the pandemic has disrupted some of this, but it's something that they really were wanting to get in there and work with the customers and see what the customers, you know, had to say. And that gave them a lot of information that they could use to kind of change things. They also wanted to put their money where their mouth was. So in Cincinnati, all city workers have the ability to put aside some of their paycheck in a direct deposit or a direct deduction type of way, and they can put that money into a customer assistance program. So they could choose to put in a set amount of money or a certain percentage of money into a fund that then goes to pay low-income customers who can't pay their bill. And it's not tons of people doing it yet, although there are quite a few in the utility, but it's slowly growing. So as time goes on, more and more people within the city of Cincinnati are dedicating a portion of their paycheck to go to a customer assistance program. So that's another way for the utility to say, we're working with you to try to help you, and we're not just part of the problem, we're part of the solution. And they've also looked at their shutoff policies, and they decided that some of their shutoff policies were not fair and equitable. And this again was prior to the pandemic, where they wanted to really change how they were going about the shutoffs, and they realized that they were hitting certain communities, and it tended to be low income and communities of color that were being hit more than other parts of the community. And it wasn't fair and equitable, and they've really looked at those policies and have changed a lot of those policies. So again, I think the subtle change of it's our problem allowed them to really look deeper and more extensively at what some potential solutions were. Another example I wanted to provide was Phoenix. And Phoenix, of course, is in the desert. It's very dry. Water is, you know, paramount. You're not going to be able to live in the desert very long if you don't have water. So they really thought, you know, again, sort of pre-pandemic, it was almost like right at the time the pandemic was happening. So earlier in 2020, they wanted to say that we really don't want to do shutoffs anymore. We don't like that idea because, again, we're in the desert and it's so impactful to somebody if they don't have water. And many people's cooling is actually tied to water in Phoenix. So it's important for them to have water. It can be deadly if you can't cool your house. So they were trying to say, well, what could we do instead of shutting people off? And they're looking at water restrictors. So they started a pilot program of putting in water restrictors to see how that would go. They just had sort of started that pilot program. They felt, you know, it was being successful because the customers were inconvenienced enough, but still had water. So they weren't going to have serious public health implications. But they had to stop all that during the pandemic. They decided to remove all the water restrictors and turn on anybody who had been shut off. So they're going to try it again after the pandemic. But it was their recognition of, you know, we don't really want to go forward with, you know, continuing to shut people off. We'd rather look at other methods and other ways of addressing the problem. So we just wanted to kind of give this overview before Shadi gets into some more specifics on customer assistance programs, to kind of frame the issue a little bit more than just, you know, will we go right back to shutoffs, or is there other alternatives that we can use? So with that, I think we have a poll now that we're going to do, Shadi, and I will turn it back to you. I'll stop sharing and turn it back to you.
Okay, thank you so much. I'm going to launch the slides first before the poll. Oh, sorry. There we go. So thank you very much, Heather. And we will now start talking about addressing customer assistance in the state of Washington, and specifically what's happening with the proclamations and what systems are doing in Washington, and show you some examples of this different types of customer assistance happening in the state. But as Heather mentioned, we do have a poll to start off. And this poll is going to be about what your experience is right now in terms of what percentage of customers are late in paying their water bills at the moment. So, you know, that obviously changes over time, but at the moment, if you just roughly estimate, you don't need to know exactly what that number is, but are you facing less than 5% of your customers have bills that are more than 30 days past due? Is it 5 to 10%? Is it more than 20% of your customers that have, 30 or more days of past due bills? And that just kind of gives us an idea of the types of challenges that water systems are facing in terms of collections, and how you're going to be able to, how many of these customers do you have to work with to provide customer assistance programs. I think we got a good response, so I'm going to give you just a few more seconds, especially for those water operators trying to get your credit hours in. Give you like 5 more seconds to complete this. All right, thank you very much. So let's share the results. Most of you said, at least for those of you who represent water systems, that it's somewhere, it's less than 5% of your customers, or between 5 and 10%. Between the 5 and 10% was the highest response. But you can see that there are some systems that are reporting that they've got more than 20% of their customers with past due bills. So we've seen this both in Washington and outside of Washington, other states as well, that there's usually a wide variety of, or a wide variation of late bills and accounts with delinquent amounts that just varies from system to system. So it's really a local issue much more than a regional or a statewide issue. For the systems that are facing with more than 20% of their customers with past due bills, that's a lot of customers that you have to go out there and try to collect on the bills or try to help them pay their bills. Systems that have less than 5% might have a little bit easier time, but of course, it depends on your system size. If you're, less than 5%, but you're city of Seattle, that might be a very different situation than a small system facing 5%. So you can see this variation happening here. Thank you for that response. And then, and in either case, you need to be thinking about what you're going to be doing to help customers going forward. So whether you're going to be resuming shutoffs or not at the end of the state of emergency, there needs to be some kind of consideration for a transition period to help your customers pay back their bills and avoid future shutoffs. So, and we'll talk a little bit more about that in a second. But next, I do have one more poll. And for this poll, I'd like to know, for those of you that do have customers with late bills, what is the average late bill? And again, this can be just a rough estimate. If you're not sure, this is not, we're not looking for scientifically sound research here. We just want to get your gut feeling, or if you know what the number is, that'll be great. What is the average late bill that you're facing? So we know that customers, some customers, or maybe a lot of customers, have delinquent accounts. How much are they holding back on, how much are you going to be trying to collect on when all is said and done here? So we've got a range between less than $100 to anywhere over $500 on average. I'll give you a few more seconds on this one. All right, thank you. That should be enough. So most of you on this call are reporting that you have somewhere on average between $100 to $250 on the late bills. There are delinquent amounts. But there are some, again, there are some of you who are facing higher levels of delinquent amounts, and there are some that have on average more than $500 or even more than $250 on average. So for a lot of customers, what we're seeing across the country, a lot of states, including the state of Washington, had proclamations or had state of emergencies and moratoriums on shutoffs that started sometime in March or April. And as the pandemic, and back then everybody was hoping that this would be kind of a 1 month, 2 month situation, and the moratorium expires in a couple of months and everything will be back to normal. I wish that was the case. But as the moratorium kind of extended and customers were still in this situation where they didn't have to pay their bills, or they were not going to be cut off for not paying their bills, more and more we've seen that the average amount that's delinquent it grows over time. And as this moratorium continues, and right now the moratorium continues through October 15th, people are becoming more and more late on their bills, and the economic conditions are not really improving significantly. So as customers come off of, or as utilities come off of the moratorium, and now you have the option to cut off customers. You have customers who've been late in paying their bills for 5-6 months, and they have $500 or so to pay off. And if they are still having economic and financial challenges because of COVID, they've lost their jobs, or they're reduced hours, or they're having to figure out daycare, or whatever the situation is, they're going to have a really hard time to pay that $500 delinquent amount. And you need to provide some kind of assistance to help them be able to pay their bills and to be able to stay connected to the water system. So it kind of goes back to what Heather was talking about in trying to provide service and keep customers connected to the water system. So thank you for the response to both of those polls. So now I'm going to kind of go just relatively quickly, just mention the governor's proclamations. Everybody in the state of Washington hopefully knows by now all of these proclamations and what was required, but just to summarize, since I think in the middle of March, there were a series of proclamations from 2023 through 2023.8, and the series of proclamations essentially, it had a lot of things in it, but essentially it was there to ensure that residential customers would have access to essential services during pandemic. So that's water, energy, telecommunications. The last update was on September 2nd, and that was Proclamation 2023.8. What that one did was extended the state of emergency and also extended the requirements for customer assistance programs and the moratorium on disconnections through at least October 15, 2020, or whenever the state of emergency is rescinded, whichever one comes first. So if we assume that the state of emergency continues on then right now the proclamation requires you to avoid shutoffs through at least October 15, 2020. At the moment, there's been a series of these proclamations that kept extending those deadlines. So there's a potential for this deadline to be extended even further. At the moment, it's October 15th, and that's what you need to be planning for. The proclamations apply to all residential customers, and it requires utilities to do the following regarding their residential customers. There isn't very much in there about non-residential customers, but on the residential side, you are prohibited from charging any kind of late fees, penalties, or reconnection fees. And that was for any of the bills that were between April 17th through October 15th. You're prohibited from disconnecting customers for non-payment unless the customer asks you to do that. And also that requires you to reconnect residential customers who have been previously disconnected for non-payment. So if a customer, even if they were disconnected back in March, and right now they're still disconnected, they were disconnected back then in March because of non-payment, they can call and say, connect me now, and you're required to connect them, even if they haven't paid off their bills that were delinquent even before the moratorium. The proclamation also requires systems, all water systems, to set up some kind of a customer support program or customer assistance program, whatever you want to call it, to help customers pay their bills and to maintain access to water now through October 15th and past October 15th. So that's the difference between the moratorium and the customer assistance programs, that the proclamation is saying even after the October 15th deadline, we want to make sure that you've got programs in place to help customers who are having a difficult time paying their bills. And the spirit of the proclamation is kind of the thing that you need to keep in mind when you're designing all of your programs and deciding what to do to help your customers. The spirit is essentially to try to maintain essential services, which in this case is water, in the home during the pandemic, not just through October 15th. The pandemic doesn't end on October 15th. The pandemic is going to continue on for several more months. Who knows for how long. The spirit of proclamation, again, is to try to ensure that the residents, the homeowners, the tenants, everybody living in homes has access to water during this pandemic for all the reasons that Heather was mentioning, that you need that access to water. So how are you going to ensure this? How are you going to be able to provide water to customers and ensure that they're still connected, even if they're not able to pay their bills, even when you have the ability to cut off customers going forward after October 15th. The spirit of the proclamation is as stated, and then it doesn't really tell you what you need to do exactly. It's really up to you. You have a lot of flexibility as far as what kind of programs to provide. This is not a prescriptive type of proclamation that says you have to do A, B, and C. I already told you what the proclamation requires you to do, but what kind of customer assistance program or customer support program you design for your customers is really up to you. You just need to design something. You need to have some kind of an option, some kind of an alternative besides just going out there cutting off customers because they haven't paid their bills after October 15th. So you need to try to do your best to make sure that your customers maintain access and avoid shutoffs. There's also recognition that utilities need to be financially resilient, that you need to be able to recover your revenues. You can't have an indefinite carte blanche for customers to continue using their water indefinitely without paying their bills, without any kind of consequences, because you need the revenues to be able to sustain your operations so that you can continue to provide public health and public safety and water to all of your residents in your community. So there's recognition that there is a little bit of a trade-off there, but you need to be able to provide some kind of a program to help customers to continue to pay their bills or to stay connected. And the proclamation also, this is important, does not relieve the customers from the obligation of paying for utility services. It's stated in the proclamation, it's stated in all the guidance documents, it's stated on most of the utilities websites that I've taken a look at, you need to make it very clear for your customers that even if you're not cutting them off, even if you're offering them all these customer assistance programs, they still owe you their monthly bills. They still need to pay the monthly bills, whether it's now or later or over time with payment plans. They owe you what you've charged them, and they have to pay that over time going forward. So this is not a waiver of their obligation to pay their bills. Now, as an anecdote, this is what we've heard here from other states that have had these kind of moratoriums. The moratoriums have already expired, and customers and utilities have already started either cutting off customers or enrolling them in payment plans and customer assistance programs in other states. What we've heard from some utilities is that the utilities would contact customers that would have delinquent amounts and would tell them, hey, you've got this amount that's due. We can enroll you now in a payment plan that will take 6 months or 12 months or whatever the period is. Would you like to do that? The customer, there's a significant portion of the customers that chose to automatically pay off the entire delinquent amount. And what we've heard from those utilities is that sometimes the customers were telling them that we were hoping or we were thinking or we misunderstood that because you were not shutting us off, at some point, you're going to tell us that we don't have to pay any of those bills. Those bills will be waived. So even with the utilities kind of communicating that they still owe the customers still owe those bills, there was a lot of misunderstanding or even just hoping from customers' perspective that you're never going to actually ask them for that money. So now that you're going forward, after October 15th, you'll be enrolling customers in customer assistance programs and you have the option to cut off customers, you might expect that some of the customers will just come in and want to just pay off everything and be caught up on all their bills. So that will actually be a good thing from the utilities perspective, because that will bring in the cash that's been held back from you. So the Department of Health has a web page that's focused specifically on customer assistance programs regarding all of this. And it's got links to guidance documents, to frequently asked questions, to different tools that you can use. And it's a really good web page. If you just search for it online, Washington Department of Health Customer Assistance Programs will probably come up as one of the first search choices. And it's got a lot of really great information in there. So I just wanted to point that out to you in case you haven't already seen it. This is where you will get updated information. So as a proclamation going forward, if it changes going forward, or if there's any guidance or new guidance that comes up, DOH will be posting all the information on this webpage. So this is a place to go for the latest info. And as I mentioned, they've got some frequently asked question documents in there that answers a lot of the questions that you might have as a water system. What do I need to do, or how can I do this? So these documents are really good, and I've seen them kind of being updated every kind of month or two recently. The latest online right now is August, dated August 14th. In addition to DOH's website, I would also recommend that you take a look at MRSC, Municipal Research and Service Center. MRSC has a whole series of documents and blogs and information about utility operations as well as customer assistance program. They did a webinar back on April 21st that focused on this topic as well. And that recording is available. You have to register for it to download it, but you can check out MRSC, and they have some additional resources, and I think they'll keep their blogs, hopefully they'll keep their blogs updated with any kind of changes going forward. So it's another great resource for the state of Washington. Okay, so what counts as a customer assistance program in the state of Washington that would meet the proclamation's requirement? And again, the proclamation requires all water systems in the state of Washington to create some kind of a customer assistance program or customer support program to ensure customers can continue accessing water in their homes. And this is for residential customers. Really, the answer to this question is any kind of process or practice that will help your customers pay their bills or stay connected. You have a lot of flexibility. The proclamation doesn't really tell you exactly what you have to do. It doesn't require a specific thing. There has been a guidance document that was attached with the proclamation that provided some options and some ideas, but it doesn't require you to do any particular program. So you've got a little bit of flexibility here, and we've seen from our research in the state of Washington that there's actually quite a variety of options and quite a variety of customer assistance programs being implemented across the state. The customer assistance program for COVID, that's in the spirit of the proclamation and what's required of systems, is that you need to be able to provide assistance to residential customers that are affected by COVID in terms of, you know, financially being affected or maybe even health effects. All community water systems need to have them. If you already have some kind of a customer assistance program and you've had that before COVID, then what you should do is at least go back and ensure that your eligibility criteria for your customer assistance program includes the ability to add any customer that's affected by COVID. So for example, if you had some kind of a program that would allow you to provide payment plans for low-income senior citizens, that's great. To meet the requirements for the COVID customer assistance programs, you need to extend that option to any customer, regardless of income, regardless of their age, to any customer that has been affected by COVID. So you could offer the payment plans to low-income senior citizens, as well as any customer that has had some kind of effect from COVID. Again, it's flexible, it's not prescribed, it's up to you to decide all these different things. What kinds of services and programs you offer your customers, what the terms and implementation of the programs are going to be, what's the eligibility criteria. As long as you include some kind of a COVID effect, then you should be fine on there. How to enroll your customers, incentivize customers to participate, and how you communicate with the customers. And the proclamation, the guidance documents really kind of, they offer a lot of suggestions, and the answer to that last one is as much as possible. Try to, blanket it across the board and let all of your customers know about all these different options that are now available to customers. And we'll talk about communication towards the end of this session. In order for the state to understand kind of the breadth and the variations of customer assistance programs that are being implemented, either have been implemented before COVID or now being implemented because of the proclamation, the state has a survey. It's a pretty simple survey they can kind of go through relatively quickly for you to answer some questions and to describe what kind of options you've already developed on their customer assistance programs. The deadline is September 30th, but that might change. But I would recommend, if you haven't already completed the DOH's survey on customer assistance program, you'll have these PowerPoint slides posted online. We'll give you the link to these slides. So all these links that you see in these slides, you'll have access to those. You can just click on the links and go straight to that. Or you can just search for DOH's customer assistance programs. There's a compendium that the U.S. Environmental Protection Agency had put together a few years ago that describes different types of customer assistance programs across the country, including some in Washington. It's a good resource if you want to sit down and read through different options and see what different systems across the country have been implementing. I'm going to try to summarize some of the options that we've seen from the state of Washington in this presentation. So we'll try to tailor it specifically to Washington. All right, so this slide has got a lot of things in it. And it shows you that there's a lot of different ways that you can help your customers that are in need. I think you've heard some of them from Heather in the earlier part of this presentation. But there's so many different ways that you could help your customers, including things like helping customers reduce their waste or water use so that they have, if you educate them about leaks and they fix their leaks, then they won't have high bills going forward. You can help avoid shutoffs by using water flow restrictors like Heather was talking about. You could design your rate structures in such a way to provide rates or to try to not ensure, but try to help your rates be affordable for at least low uses so that the basic needs of all residents are met through low rates. So it's affordable for the first few thousand gallons of consumption. I'm not going to talk about that specifically in this presentation, but I'm happy to answer questions about them tomorrow. In the state of Washington, there are a lot of utilities that have discounted rates. You are allowed to charge lower rates for low-income customers. I think it's called you can use public gifts for poor and or infirm. So we've seen a lot of utilities that have low income rates or low income senior citizen rates or low income and disabled customer rates, different variations of this. So you are able to provide discounted rates in the state of Washington, which is unusual. Most states don't have that authority, but you do in Washington. You can look at ways to try to provide alternative payment methods. So if customers aren't able to access, to go to your customer service desk because you've reduced hours or even shut those down because of COVID, then think about ways to, different options for customers to be able to pay their bills. Levelized payments, extensions, deferred payment plans. I'll be talking about the rest of these in the next few slides. And I'm highlighting here specifically the types of assistance that you can provide that would help their customers pay their current bills. So the things in bold are the ways that you could provide, or the options that you can provide your customers who are currently having bills or having late bills that they have to pay off, or the customers that you are concerned about, past October 15th, when you are able to start cutting customers off. These are the customers that might have some bills, and you might be going out there shutting them off from water. These are types of programs that you can offer to them to help them get them caught up on their bills so that you don't go out there shutting those customers off. And I'll talk about each one of these directly. I'm going to ask a poll question here, because what we're hearing from some systems is that even though the proclamation says that starting October 15th, you have the authority to go back to shutting off customers, I'd like to know whether or not your utility is considering extending that deadline, that you're going to continue to suspend your disconnections even after October 15th. Because we're hearing from a lot of systems, for the same reasons that Heather was talking about, that they want to try to help their customers as much as possible, and they don't want to start cutting off customers as soon as the state of emergency or the proclamation period has ended. So they're voluntarily extending suspension of disconnections going forward. And some are considering doing it through to the end of the year, some are considering even longer periods than that. And there are some that are saying, well, by the time we charge, we're not going to cut them off for anything that for all bills, up to October 15th, but by the time we send them their next bill, and then by the time that bill becomes delinquent, and by the time they then become eligible for shutoff, it's really a few more weeks before we're going to cut off anybody anyway. Just kind of get a sense of what your plans are going forward. All right, so I'm going to stop here and share the results. So you can see that a lot of the utilities are saying that, actually, more utilities are saying that, yes, you're planning to voluntarily extend the moratorium on or suspension on shutoffs even after October 15th. There are some of you that are just going to automatically resume going back to shutting off customers, but many of you are voluntarily going to delay the option to or your ability to cut off customers going forward. And I think that falls in the spirit of the proclamation, which is great. But even those of you who are saying that starting October 15th, we're going to resume the practice of shutting off customers, as long as you're still providing customer assistance programs to try to minimize those shutoffs going forward, and then you're following through on the proclamation and what the governor is asking for. So you should be fine. And the goal is for you to try to get everybody enrolled in some kind of a customer assistance program so that you don't cut off anybody for any of the bills that they've been delinquent on going up until now. Thank you for that. All right. So let's talk about some examples of customer assistance programs. First one is a simple extension on deadlines. You could just say, you know, all right, the bill was due October 30th, or all the bills that you had going through this period, you know, you're expected to pay them October 15th or October 30th, whatever the date might be, providing just a straight up extension. Say, all right, we're not going to ask for that bill until November, December. So you have time to pay us. You have more time to try to pay us, pay those bills back. So that's an extension. Then you've got deferred payment plans. And this is by far the most common customer assistance program. Coming up with a payment plan to spread out the payments over time so that the customer is paying only a small portion every single month up until a point where they're caught up on all their bills. So it's a regular payment plan. And there are different ways. There are a lot of utilities in the state of Washington that already have those plans or are developing those plans right now. And I'm going to show you some examples. The majority of the ones that I've seen have been kind of individualized. Individualized meaning that the utility is planning to work one-on-one with each customer and come up with a payment plan that works for them. So if a customer comes in and the utility might have a minimum payment plan period, but they might, you know, offer 8 months for this customer, 12 months for that customer, depending on the amount or depending on the specific conditions that the customer might have. So you're working with them one-on-one. And this is actually in the spirit of the proclamation. The guidance documents actually kind of suggests that you try to work with each customer individually and come up with some kind of a plan that would work for them and work for you. And this is one example from Manchester Water District. That's, you know, they have a document on their website that explains that we'll work with you to extend your due dates or to make partial payments over time. We'll find a solution that works for all of us. And there are so many of these examples right now in the state of Washington. So that's one option. The other option is to do it through a standardized program. So you're not going to work one-on-one with each individual customer. You're going to have a payment plan program that's on your website that explains exactly what the terms are going to be for everybody who joins the program. And that's the case of Lake Haven's Water and Sewer District. They've got on their website that says, you know, if you've got a balance that's between $200 and $400, then I'm guessing that's under $400 in general, but between $200 and $400, you'll have 6 months to pay that balance. If it's somewhere between $400 and $600, you'll have 9 months. And if it's more than $600, you'll have 12 months to pay that balance off. So you're allowed to do that. You're allowed to have different levels of payment plan periods. Now, for payment plans, the goal is to have a long period. That way you've got the ability for customers to pay the bills over a long period of time, at least 6 months. The guidance document that originally came with the proclamation suggested 6 to 18 months. That I would say, you know, aim for a minimum of 6 months, and the longer the better, especially for customers that have high balances, because it will take them some time to try to pay those bills, especially if they are still affected by COVID, and you know, and their finances are not are not conducive to being able to pay off very quickly. Deferred payment plans for COVID, again, was suggested to be 6 to 18 months, the longer the better, or to work individually with each customer's needs. And you need to be clear what those terms are. So when the customer signs up to a payment plan, or you're communicating with them about their payment plan, they need to know how long they're going to be paying their bills. And also, you know, if you're requiring any kind of payment up front, when those payments are going to be due. What happens if they miss a payment? Do you automatically go back to shutting them off because they've missed one of the payments from the payment plan? Do you apply a fee? Now, I would say that applying a fee, you know, again, consider the spirit of the proclamation that you're trying to, as much as possible, work with the customers to keep them connected, and to try to minimize the financial impact for them. So try to think of ways to try to minimize shutoffs or fees in case of missed payments. And then some other examples. So we've already talked about the first couple of examples, but Columbia Valley Water District has, they have an interim payment plan for the period through October 15th, or for as long as the state of emergency is still in effect. customers right now can get onto an interim payment plan. And the interim payment plan would require, you'll continue to pay your bills up to the point where the state of emergency or October 15th comes around. At that point, that customer needs to have paid off at least half of their delinquent amounts in order to be automatically enrolled in one of those final payment plans. So whatever is remaining will be then entered into another 4 months or 6 months or 9 months payment plan after October 14th. If the customer is not able to pay off half of the delinquent amounts before October 15th or the state of emergency ends, and they're switching off of the interim payment plan to a final payment plan, Columbia Valley Water District will say, well, okay, because it's more than 50%, we're going to require you 90 days to pay off the full balance. So they're trying to incentivize the customers to pay as much as they can during the interim period so that they have a longer payment plan going forward beyond 90 days. And then you've got other examples like Lakewood Water District, where it says they're going to defer payments for 4 months after that state of emergency or October 15th comes around, and then request an 8-month payment plan going forward. So it's 4 months of no payments. It's just an extension there, and then 8 months after that. And the last example was that the utility would provide up to 1 year to pay off the bills, but the general manager has the ability and the authority to approve for extenuating circumstances 2-year period plans for individual customers. So it's sort of like a standardized plan with 1 year plan, and then with the ability to customize going forward. All right, so switching from payment plans to other types of assistance programs, one option is to eliminate late fees and other fees. And again, with COVID and with the proclamation through October 15th, you're required not to charge any late fees or reconnection fees. Some utilities have offered or have included in their customer assistance plans to continue waiving late fees and reconnection fees going forward as well. So even past October 15th. Elimination of convenience fees. So if you're charging convenience fee for customers who are paying online or paying through credit cards, what we've seen, or at least what one colleague of mine has seen from a utility that's not in Washington, but they've looked at payments and what happened after the utility removed the convenience fee, and what they've noticed is that there was a significant jump in the number of customers who chose to pay online after the removal of convenience fees. And that makes a lot of sense because nobody wants to be paying an additional fee for the convenience of paying online. And if, as a utility, if you're trying to recover the monthly bill, and that's really the main source of revenue for you, if you sacrifice that $2 or $2.50 or whatever the convenience fee is in order to recoup the monthly bills, and that's it's a win-win for you and the customer. So that's one option that some utilities have chosen to do for COVID as well. Bill forgiveness and adjustments, you are allowed to just remove or to forgive customers of specific bills or portions of the bill. So you might say, we're going to give customers who have been affected by COVID 20% discount on their delinquent amount, or some kind of reduction in the bills that they owe. And you could also, we've been asked whether or not there have been any utilities in Washington that provide a deferred payment plan, and as long as customers continue to pay and are still in good standing over time, then towards the end of the payment plan, they just forgive the last portion of the bill. I don't know of any examples that have done that in the state of Washington, but you have the flexibility to do that in the state. You can combine payment plan with bill forgiveness as well. Leak adjustments are very, very common. If customers have, and that's just another example of customer assistance program. This one's not really related to COVID. This would apply to anybody that had leaks. And this is one example that you can take a look at from City of Duval that specifies how the calculation, or what the customer might expect for reduction in their bill. Discounted rates, again, the state of Washington, there are so many utilities that have low income rates that are specifically for low income, and rates that are low income senior citizens or low income and disabled or blind, and there are different criteria that you can use. These are the most common that we've seen beyond payment plans. So payment plans is really number one, and then discounted rates. And these are, rates that these utilities have had since before COVID. You could choose to implement them going forward as well. Now, anytime you do something like this, you would need the governing board's approval or a public review period, whatever the normal process is to get these approved and implemented. Okay, and then the last one we want to talk about is customer assistance programs to help customers actually pay their bills. So these are programs that utilities would either administer themselves or would work with, more typically would work with a nonprofit or another organization in the community, where there'll be a significant portion of money, there'll be a portion of money available to help customers who can't pay their bills. If a customer can't pay their bill, they would go to whoever's administering this program and show their bill and say, this is the portion that we can't pay. And this program would help pay off that, either the full bill or a portion of the bill. And there are different ways that you could design these kinds of programs. And these are the decision factors that you have to consider when designing these programs. We have seen several utilities in Washington that have developed these kind of bill-paying customer assistance programs, and there's more and more interest in them now, especially since you could use some of the CARES Act funds as well as CDBG funds to provide that kind of assistance to help customers pay off their bills. The decision factors you have to consider would be things like, what's the eligibility criteria? Who's going to get the assistance? And how often? Is it going to be a one-time help, or are you going to be able to provide that as many times, or twice within a year? How long are you going to offer that for each individual customer? What kind of assistance are you going to provide? Is it going to be up to $100, or is it going to be up to the full amount of the bill? How much is that program going to cost you? How much do you need to generate to fund this kind of program? And I'll talk about that in a second. And then devising a plan to partner to fund the customer assistance program, as well as to partner with organizations for administration. So who gets assistance? What we've seen typically for bill-paying customer assistance programs is that utilities would partner with organizations that typically work with or help community members that have specific needs. So there may be some organizations that are out there to help low-income customers, or an organization out there that are helping senior citizens, or a combination, or anybody that meets specific criteria. And those organizations are out there helping community members pay for rent, pay for utilities. Sometimes it includes food banks. There's a lot of different kinds of assistance programs. Those organizations are really in great position to try to help customers with their utility bills, because they're working with them one-on-one already. And proof of eligibility for a lot of these programs comes in many different forms. On the energy side, it's usually regarding LIHEAP, Low Income Home Energy Assistance Program. They have very specific criteria for income, as well as other things like if you're on Medicaid, then you're eligible. If you have SNAP, then you're eligible. So there are some criteria that really are tailored to different kinds of programs. For COVID, if you are going to implement a bill-paying customer assistance program, again, keep in mind that the COVID CAPs need to help any customer that has been affected by COVID. So even if they're not low income, if they can attest or verify that COVID has caused them some kind of a financial concern or issue, and they can't pay their bills, then they should be eligible for the same program as well. So that might mean going back to the bill-paying customer assistance programs and adding that as another eligibility criteria, that COVID has affected you financially in some way. And if so, then it doesn't matter whether or not you're low income or you meet these other criteria, that you're automatically eligible for this program. How these programs are funded, comes from many different ways. Sometimes utilities would use either their general funds, so the local governments would use their general funds, or would more commonly in the state of Washington to use donations, to ask people to donate into this program. For example, and then you can also combine things, like the City of Spokane has combined donations with city revenue. They're matching the donations I think it's 2 to 1. For every dollar that's donated by the public, City and then Avista, which is another customer assistance program, are both matching it 2 to 1. You could do voluntary bill roundups, or you could look to use your non-operating revenue. So for example, if you're leasing your water tower for cell phone companies, you can use some of that non-operating revenues that's coming to your water system to fund customer assistance programs. And you can also use your CARES Act funds to provide some kind of cash to these bill-paying programs as well. You could, in the state of Washington, at least now, also use your revenues, your rate revenues, to fund customer assistance programs. And I think you're the only state in the country that has allowed this, at least explicitly has allowed this. If you're a utility that's regulated by the WUTC, they've actually, because of COVID, have now given permission to all the utilities there to fund these kind of bill-paying customer assistance programs through the revenues that are being collected from other customers. If you're a local government, you could implement low-income customer assistance programs funded by rate revenues and determine kind of eligibility criteria as well. And you can waive connection fees and tap fees for low-income customers as well. CDBG has recently actually received additional funds that are available, that's designed really to help residents pay for utility and rent or mortgage. So there's an influx of of cash that's available right now to help customers dealing with COVID, to help them pay for utilities and rent and mortgage. And those funds are typically administered. CDBG will provide grants to local governments or their partners to administer these programs. So CDBG, HUD is not going to run the program for you. They need to partner with either you or with your administrator for your customer assistance program to provide them the cash, and then your program will run, will administer those funds and determine eligibility and make sure that you're getting your revenues back from customers paying their bills. And I've got some examples here for customer assistance programs, but in the interest of time, I'm going to save those and I'll bring them back up tomorrow because I want to kind of go through the last portion of this. And again, there are a lot of examples both on this slide deck, and I'll mention this one tomorrow, as well as the MRSC website. They've gone through and identified some examples, and DOH's website have also got some examples there too for you to take a look at. But I'm happy to talk about some examples tomorrow. If you're interested to know how much it would cost to actually design and to fund a bill-paying customer assistance program, we have a spreadsheet tool that you can use to estimate those costs. And we can work with you one-on-one on those tools. Regardless of the customer assistance program that you're using, you need to communicate those to all of your customers, not just customers who have late bills, but also to everybody, to let them know that if they're dealing with COVID and they're having a difficult time paying utility bills, you have these options available for them. And the common ways to provide outreach, one is to post on your website if you have a website. And then bill stuffers or door hangers, emails, direct mail, any way to communicate directly with a customer. And what's often forgotten about is to communicate with the nonprofits and with organizations within your community that focuses on helping residents and helping people. So talk to your nonprofits, social services, charity organizations, religious groups, community groups. Let them know of your customer assistance programs and what you could offer customers so that they can communicate with the people that they're working with as well. And that's another way to provide some outreach in addition to local media. And then customer service desk. I mean, you can determine from your billing records who's having a hard time paying their bills, who's got high delinquent amounts. And you could start with them. You can contact them and let them know that you're able now after October 15th to start shutting off customers, but in lieu of that, or instead of that, how about you participate in one of these other customer assistance programs that we're offering to you so that you can continue to receive service. So I think I mentioned where to start, but just to kind of summarize, look at DOH's website. If you have a CIP, make sure that the eligibility criteria includes anybody who's affected by COVID, and then take a look at you and see what the level of need is at your utility so they have a better understanding whether just payment plans will be enough for everybody, or if you need to provide some bill paying assistance or other types of assistance to, because you have a lot of customers with different needs. If you're interested in new programs, take a look at some examples. And again, I'll be sharing these slides. And then post your information on your website and start by communicating with your customers who have delinquent accounts, but also communicate with everybody beyond that. But it's a good starting point to communicate with those who have delinquent accounts that may be cut off for non-payments. Okay, I'm going to stop here. I'm sorry, I think we are over in time, but I'm going to ask Heather and Allison if there's one maybe very pressing question for me to answer right now. Otherwise, we'll save questions for tomorrow. Heather, is there anything that in particular we should answer?
I think for the most part, they look like fairly lengthy questions. So I would suggest that we save these till tomorrow, because I think in the interest of time, let's focus on these. So if you come back tomorrow, we'll address the questions that came in through the chat box. And then we'll also be talking about questions that came in prior to the prior to today's webinar in the registration. So please join us tomorrow. And then you can also ask other questions tomorrow, because the whole thing tomorrow will be just Q&A. And then maybe Shadi will go over a couple of these examples that he talked about. But for the most part, tomorrow's session will be Q&A. So you feel free to ask additional questions, and then we'll address questions that came in through the chat today and through the registration.
Thank you, Heather. And I'm posting right now on the screen both Heather's and my email addresses. We're happy to answer questions by email as well. But tomorrow would be, that is the whole point of tomorrow, is to have a Q&A session. So we're happy to answer your questions there tomorrow. But feel free to reach out to us. And then we could also pass, even after the webinar tomorrow, we could work directly with water systems that are serving less than 10,000 people to address specific questions. So if you have more questions later on and you need some assistance, we're happy to work with you one-on-one at no cost to you, again, because of the cooperative agreement we have with EPA. So we'll mention that again tomorrow, and I'll provide the link for that tomorrow. Thank you for your time, everybody, and for your attention. And tomorrow we will see you, I think, at 10 o'clock your time.